The people of Swansea are deeply concerned by this week's announcement that the Health Board is proposing the loss of around 800 posts. Whilst I do recognise that these proposals are intended to provide greater financial stability and reduce reliance on expensive agency staff, in fact, workforce planning in the long term is an issue not just in Swansea but across the entire Welsh NHS. But these changes come at a particularly challenging time, when we are also seeing reductions in training places for future healthcare professionals, despite the clear need to recruit and retain more NHS staff. And there is undoubtedly a need to rebalance the way our health service manages its finances, but patient care must remain the overriding priority. Therefore, will the First Minister outline what discussion is taking place to ensure that these workforce changes do not negatively impact patient outcomes or the quality of care that patients receive in Gwyn? Diolch.
Decisions on workforce, of course, are down to the health boards themselves. All NHS organisations need to have a clear workforce plan that supports safe delivery of their service models. And to keep those plans under review in the light of needs of their population, their overall financial position. I am very, very aware of the concern around the plans announced in that particular health board. The key thing is here that health boards and trusts have that responsibility to ensure their workforce plans reflect their local population needs. And I and my health minister would urge them now, in light of those concerns, to ensure that any proposals that they bring forward will not have a detrimental impact on the health of the people of that part of Wales.